Why is my sex drive so high? Changes in sex drive or libido are normal and can occur due to changes in hormones. However, having a high sexual drive can become a problem if it starts disrupting someone's daily functioning. It's important to note that there is no definition of a normal sex drive, and what one person sees as a high sex drive may seem normal to someone else. Many people are curious about the nature of their sex drive. This video explores some underlying causes of a high sex drive and provides some tips for managing or reducing it. What is sex drive? Sex drive, otherwise known as libido, refers to a person's desire for sexual activity and arises from the basic biological need to reproduce. It is a natural feeling that anyone can experience, whether they want to reproduce or not. Levels of libido exist on a spectrum from no desire for sex at all to wanting to engage in sexual activity very often. Having a high sex drive is not an issue unless it excessively preoccupies a person's thoughts. For example, a person might wish to reduce their sex drive if it interferes with their work. Social life, sleep, or health affects their mental health. It is difficult to feel satisfied no matter how much sexual activity they have. Affects the quality of their relationships. Causes them to seek out opportunities for high-risk sexual behaviors. Causes of high sex drive. What constitutes a normal sex drive differs for everyone. And people are likely to desire sex more at different times in their lives. Sex drive depends on factors such as age, mental health status, energy levels, physical health status, relationship status, social interactions, medication, alcohol, or drug use. Age and hormones. Hormonal changes play a big role in sexual desire. A person's libido can be affected by the gonadal steroid hormones, which include testosterone, estradiol, and progesterone. Levels of these hormones can vary depending on a person's age. For example, hormonal surges caused by puberty can trigger feelings of sexual desire for the first time. Hormone levels will continue to affect a person's libido throughout their life. Mental health. Stress levels can also influence how sexually charged a person feels. In times of high stress, some people might feel low sexual desire, while others might seek sexual satisfaction as a stress reliever. Physical fitness and energy levels. Research from 2018 has found that physically fit people are more likely to desire sex and enjoy heightened arousal and better orgasms. Relationships. Having enjoyable sexual experiences, either with others or through masturbation, might also lead to an increased desire for sex. Research has shown that intimacy between sexual partners has an effect on sex drive. On the other hand, if a person is unable to feel satisfied, either through a lack of sex or unsatisfying sexual experiences, their sex drive might also increase. Substance use. Alcohol consumption lowers inhibitions, which might increase libido in the short term. However, alcohol dependency might decrease sexual arousal, performance, and satisfaction. Sex and sex drive. Regardless of sex, a person's sex drive can vary depending on their mental health, outside stressors, and hormonal fluctuations. A 2023 article notes that there are many misconceptions about sexual desire in males and females, with common assumptions being that men experience stable and high levels of sexual desire. Women experience more variable levels of sexual desire. And a woman's libido is weaker and more sensitive. However, there is very limited evidence to support these assumptions. Female sexual desire can fluctuate throughout the menstrual cycle. A 2023 article notes that findings are unclear on when a person may feel more sexual arousal during the ovulatory cycle. Some research suggests that people may feel an increase in sexual desire during the days they are fertile or halfway through the ovulatory cycle. Other research has concluded that female sexual desire can increase during the days they are least fertile. Pregnancy can also affect a person's libido due to fluctuations in hormone levels. A survey conducted in 2023 found that some people reported an increase in sexual interest during the second trimester of pregnancy. Learn more about libido changes throughout pregnancy. Testosterone is the key male sex hormone. And levels of testosterone can have an effect on sexual desire and function. For example, low levels of testosterone can be a contributing factor to a low libido. Is it possible to have too high a sex drive? Having a high sex drive only tends to become problematic when it interferes with other important aspects of life, or if a person feels compelled to seek sexual activity in a way that feels out of control. This is known as compulsive sexual behavior. Sometimes, when the libidos of sexual partners are not compatible, it can cause friction in the relationship. Learn more about mismatched sex drives. How to lower libido. For anyone worried that their sex drive is very high and needs addressing, some strategies may help. The following are some things a person can try to help lower sex drive. Try talking therapy. If having a high sex drive is making a person unhappy, a counselor can help them explore their thoughts, feelings, and desires around sex. They can help the person find ways to manage their sexual desire and any issues associated with it. Try distraction. Engaging in sexual activities, either with a partner or through masturbation, is likely to perpetuate the need for more sex. So, if a person is keen to lower their sex drive, it may be worth trying not to act on every sexual impulse. Distracting the mind with some form of physical exercise or an absorbing task might help a person channel this energy elsewhere. Allow time for a relationship. People with a lower sex drive may misinterpret any intimate gesture by the other as a bid to have sex. It may help to agree to be intimate without having sex. For example, go on a date or give each other a massage to show care for the other person, not so that they are more likely to agree to have sex. For most people, having a high sex drive is a perfectly natural part of life. It comes and goes depending on many factors. It is usually nothing to worry about. But if it is causing stress or affecting other parts of life, it may be worth trying to channel this increased sexual energy into a different activity. In extreme cases, a person can try seeking professional help. Every person has their own sex drive. A number of factors may cause it to increase or decrease. People may use the term high sex drive to mean an increase in desire for sex. Libido, which is another word for sex drive, varies from person to person. It can also fluctuate due to a range of factors such as exercise, stress, age, and more. Read on to understand why some people may have a high or low sex drive, plus tips on how to increase it. Sex drive or libido refers to a person's desire to engage in sexual activity. A low libido refers to a decreased desire relating to sex, while a high libido is an increase in desire for sex. Causes of higher sex drive. Some reasons that a person may have a higher sex drive include exercising. One study suggests that people who engage in physical activity tend to have higher sex drives. Drug taking. Stimulant drugs such as cocaine can cause an increase in libido. Changes in neurotransmitters. Dopamine is a neurotransmitter. People with Parkinson's disease may receive dopamine replacement therapy. This can cause hypersexuality and atypical sexual behavior, testosterone. Some older research suggests there may be a link between higher testosterone levels in men and higher sex drives. A note about sex and gender. Sex and gender exist on spectrums. This article will use the terms male, female, or both to refer to sex assigned at birth. Causes of lower sex drive. Some reasons a person could have a lower sex drive include menopause. Studies looking at female libido highlight that during menopause, sexual hormones decrease. This can cause a decline in sex drive and arousal. Learn more about how menopause affects sex drive, culture, and religion. According to some research, people who are subject to highly restrictive religious or cultural beliefs may have lower levels of sexual desire. Mental health. Research suggests that males and females with mental health conditions, such as anxiety or depression, may have a higher risk of difficulties with sexual health. This can lead to a decrease in sex drive. Age. Sex drive may fluctuate as a person ages. One older study highlights that once people reach the age of 60 years, there is a decrease in libido. Obesity. Some research suggests that a link exists between obesity and difficulties with sexual health, which may lead to a lower sex drive. Chronic conditions. Chronic conditions such as diabetes and heart disease can cause difficulties with sexual health, which may reduce sex drive. One review highlights that both the biological effects of diabetes, such as nerve damage, paired with psychological effects, such as self-image and tiredness, can decrease libido. Pregnancy. One study notes that females tended to reduce their sexual activity during pregnancy. One of the main reasons for this was a decrease in their libido. Learn more about how pregnancy affects sex drive. Relationship satisfaction. One 2018 study indicates that the libido of some females may decrease depending on their satisfaction with the relationship. Medication. Medications or treatments may cause a decrease in a person's sex drive. Some of these include chemotherapy. In males, chemotherapy may reduce testosterone levels, which leads to a decrease in their sex drive. For females, chemotherapy may also cause the libido to lessen, as it can cause the early onset of menopause. Female hormonal birth control. A review of females and hormonal birth control highlights that the following birth control methods may decrease libido: contraception ring, injection, implant. Antidepressants. A historical look into antidepressants and difficulties with sexual health suggests they may decrease sex drive. Learn more about causes of a low libido. How to increase sex drive. Some people can try the following methods to help increase their sex drive: sex therapy. A sex therapist can assist with sexual difficulties. While they can help increase sex drive, they can also support people to reach orgasm, increase sleep. A 2023 study suggests that low-quality sleep had an association with sexual difficulties. Therefore, aiming to get enough sleep may help regulate sex drive. Aphrodisiacs. According to 2013 research, herbal aphrodisiacs such as yohimbine and Eurycoma longifolia may help increase male sex drive. Certain foods such as strawberries, chocolate, and raw oysters could also have aphrodisiac properties. Exercise. People may increase their libido through exercise, mindfulness, and yoga. Testosterone therapy. Testosterone therapy in older males has shown it could help them regain their sexual desire. Research that explores testosterone treatment and sexual desire in females varies. A 2016 paper argues it is unlikely to increase female sexual desire. However, a 2019 review suggests that it can boost libido in females. More research is necessary to establish the effects of testosterone and sex drive in females. Learn more about ways to boost libido. What is a normal sex drive? It is best to view sex drive as a spectrum. What someone may consider normal may be different for another person. Sex drive can also fluctuate, leading to a higher or lower libido. In some cases, a person's sex drive may become extremely high or extremely low. This may develop into a sexual functioning disorder, which can include female sexual interest arousal disorder, FSIAD. This difficulty with sexual health involves a persistent lack of sexual desire not caused by a medical condition or medications. Treatment for FSIAD may include counseling or medication. Compulsive sexual behavior. The World Health Organization includes compulsive sexual behavior in the International Classification of Diseases. This is an impulse disorder characterized by a persistent pattern of failure to control intense, repetitive sexual impulses or urges resulting in repetitive sexual behavior. Summary. Sex drive is a spectrum, and what may be typical for one person may not be usual for another. There are many reasons why a person may have a high or low sex drive, or why it might fluctuate. Medication, age, and chronic conditions can all affect it. Some ways to increase libido include exercise, sex therapy, or getting enough sleep. If a person is worried about any changes in their libido, they can discuss this with a doctor.